All right, Doctor, we're live in the mirror.
Hey guys.
In New York.
We are here in New York. How are you? It's Saturday. And I'm really excited because we were traveling on Friday, so we couldn't do our female facial sculpting day. So
Sculpting
today,
Saturday, not filler Friday.
So yes, not filler Friday, so we're gonna do sculpting Saturday. And I have a beautiful patient here who is coming for filler for the first time, and I'm excited for her because the issue with her really honestly is that she's had a lot of up and downs in weight, and that has caused her to lose volume. That's made her a little loose, and some of it's contour. She's gonna need probably more into the chin, but what I want to do is just do a subtle amount just so I can get her used to the look, give her that improvement, and also to the mid face. Her, if you take a look, most women, we really want that heart-shaped look. By elevating here and projecting there, go ahead and let go. We need to bring this forward a little bit more, but let's start building this.
And can you talk about how it's not like a one and done? It's a building process, it's over time, it's maintenance.
Yeah, and the thing is, like, the amount of volume she probably needs is more, but you don't want to scare someone on how much you're doing initially, so it'd be better to develop that relationship, you guys, and do it slowly. I want her to see like how much improvement she can get and how good she looks when she starts taking pictures of herself and all of that, so we can really see that big improvement right away, and then she'll get happy, see the face, and we slowly improve it, because if you do too much right away, then the person looks unnatural, and like Jordan, tell them about you. You had very recessed
I had a
facial
very
features.
recessed chin.
And so when we did it, you were
Originally,
nervous,
I told Dr. Emer you could only do a certain amount of syringes.
Right, he was very nervous.
And then we came back a few weeks later, we're like, okay, this was not enough, and I did the full recommended plan.
Right, so, but that was good though, because why? Why was that good for you? What did that do? Did it make you comfortable?
It made me more comfortable, I loved it. It just looked great.
You felt more confident in doing that.
Yes.
At that point, right? So now you guys see I'm elevating her.
Sometimes you just start small. You can always come back a few days later, a few weeks later, add more.
And I'm using radius on her. I know a lot of people out there can be like, why radius? And there's a lot of nurses who don't only HA fillers, but this is gonna give her a much better value. It's also gonna give her more sculpting. Like, she needs this lifting. She has a lot of laxity there. And there's other treatments for laxity like threads and smooth wave and other
face
things.
tight, everything.
Yeah, surgery and things, but like she doesn't want surgery. She just wants to look good.
But I think when you're getting radius, you need to go to someone that's experienced with it.
And with her, I'm doing a really high
because
because I want her to really see the pop, because it's gonna make a difference for her face. The type of face shape she has, you need that height back here. And a lot of people tend to do all the filler in the front, you guys, and that then makes it look. I'm gonna switch sides. We come on this side. That then makes it look overdone. Oh yeah, those look amazing, that difference. Wow, that's really big.
This is one of our longer term fillers too.
So again, and the thing about radius that I like, you guys, is again it will build collagen over the time that it's here, unlike HA fillers, which don't do that. I just want her to look more snatched. As you guys see, I'm going as slow as I can. She's nervous. I want to make sure it comes out great.
She's looking great.
It's looking perfect. I'm not worried at all. No issues. I'm going slow so we can let it sort of sit in there and build its structure. Let me see again. But I am doing a little bit more than you typically do for people in the mid-face initially, because she needs it. Otherwise, she's not going to see that substantial lifting that we want. So it is doing a couple syringes versus doing just one. Sometimes you need that. Like, it's all customized. It's very important. And one of the things I tend to do much less as I've done more and more treatments, you guys, is less under eyes, more skin tightening, lifting, and cheek. Oh wow.
Dr. Emer.
Yeah.
I want you to talk about how it's an artistic approach. It's not just 0.5 here, 0.3 there.
Yeah,
talk about how it's
companies are going to train you in sort of these protocols that they've developed with drawing lines, and you really can't. I mean, it's good. That's good for a beginner to know kind of where to go and where anatomy is, but we really have to approach this based on artistry, and it's very hard, you guys, to find. Still, I gotta go on the other side one more time. It's still very hard for people to know artistry nowadays, because remember, you can use AI right now and literally just make an image of whatever you want. So you have to be so careful to know what's real and not. Nowadays, look up your head just a little bit. Wow, that's a much bigger difference. You guys can even see that contour. So like here's an example where on this side, I need to come a little higher on the cheekbone to help her get lifting for the under eye and mid face. I know it feels weird there. Perfect. And then eventually we could do maybe a little HA over there.
I would say if we did the same to each side, she would look distorted.
Exactly. So we're definitely not doing that, because she's a beautiful young girl that we need to have features pop. Okay, let's switch sides. Now.
That's why expertise is key.
Oh, I need a long camera. What's that? Now I'm going to do another technique that's going to help her chin substantially. This is the part I want to do. So this part I need you to look all the way up with your chin. High, high, high. There you go. You're going to feel one little pinch. That's it. Yep. Turn left now. Now you can really see those contours. Go ahead and grab that for me. Yep. And we're going to use a cannula, so it's going to like not hurt at all. This is a blunt instrument, but it's going to help me blend her chin. Now remember, projection was the main thing, but because she does have some looseness here, you guys, I do want to give some support to the edge of her marionette. Turn left a little bit more. There you go. And kind of soften this corner exactly right there so that we get a little bit more contour and a little bit more of a projection for her chin. There we go. So now I'm going to switch sides. We're going to come back to the other side. You switch with me.
She's going to be so happy.
She is. Let me see. Oh, sorry, it's me. Don't worry, it's me. You're totally fine. So we're going to do the same thing. Her muscle here is really strong. So where my goal is, we're going to Botox that a little bit. Turn this way. But because her muscle comes below, you see her muscle comes below the edge of the bone, we need to tox that and then bring the filler a little bit lower. Otherwise, she'll look like there's a little dip right there. Look up again with your chin and look to the right.
They're saying,
yeah.
I've been thinking about sculpting my jaw. You should come see us.
That's like one of my specialties, you guys.
It makes someone nervous. You know,
YouTubes years ago.
Someone said they're nervous. I was nervous too. I waited 3 years to do it working with Dr. Emer, and then I regretted not doing it sooner.
So it just feels weird because you're doing like, they use the cannula a lot on this.
Are we in New York? Yes, we are. We're in New York for just next week only, and then we'll be back again in July.
Yeah, we're here in our Manhattan office.
So if you want to come, make sure
but
you can.
We do have an amazing injector now that's here, Lena. If you guys do want to go to someone and not me, almost done.
If you want to come, you guys can DM us on Instagram with your full name, email, and phone number. Or if you're on YouTube, there's a link in our bio. You can go there, go to our contact form, let them know you want New York as soon as possible. We will get you in.
Perfect. And then I'm going to use the little extra that I have to refine the front now of the chin, because her chin naturally was a little crumpled. She has a little crumpling.
Someone's coming in.
And love it. Tell Jordan have them.
You guys mention my name. My name is Jordan, and I'll take care of you.
Right on the DMs to Jordan specifically. So I'm trying to now blend
They're on YouTube.
bone. Oh, perfect. And right on there. There we go. Because it's based on her muscle shape. Perfect. All right. So that will all blend once the swelling goes down. And then the last part, my favorite part, is to do a little bit to her under eye. Now, we're going to use a small. Okay, perfect. Let me do, because turn a little bit this way. She has that little bit of drooping right here in this crossing area. Draw lines like right there. We need to use a little bit. Go on. Perfect. It's not going to be, yeah. It's not going to be the very superficial portion. It's going to be a deeper portion so we get more of that blended look. And it's going to be great. And I'm going to use Volbella here because it's soft and it will give her a nice longevity. Perfect. So that's good. You guys can see now much smoother through there. I love it. Okay, switch. And then we'll be done.
It's fantastic.
Oh my God. Can't wait to see it.
I can't wait for the Emer reveal. I can't wait for the Emer reveal.
I know. I don't think she even knows what to expect. She just knows that it always looks good. Go ahead and grab it. Perfect. Okay, same thing. A little bit deeper, just to get that lifting into that crease. Perfect. We're using a cannula, guys, so it's very minimal pain or bruising. And that's it. And then I'm going to show her real quick. We'll do the Botox off. Let me clean her, and we're going to do an Emer reveal. So, hard part's over. She's smiling now because she's not nervous anymore.
Don't worry, the Botox is still left.
Really quickly while she's smiling. Look. You see the volume? She had so much more volume.
Oh, this looks fantastic.
Wow, it's so good. All right, let's give her the phone.
All right, you're gonna take a
Show her how to
selfie.
do that. Bring that halo a little
I'm gonna
bit
give you the
closer.
phone. You're gonna take a selfie.
So hold this phone, look up, and hold it 45 degrees. Grab it, and take a look at the contours. What do you think?
Oh my God.
And it's natural looking. Remember, you can always do more, but you know what? Look how much it lifted. It's swollen, obviously. Look how much this came out. Turn this way. Look at your neck, your chin, and look at your. Doesn't that make a huge difference?
Yes, I love it.
See, and the thing is, look, you guys, she has an amazing smile, really big, beautiful lips, but when the chin is back, you just don't have that contour. And look at your under eyes. Like, hold it up like this and look kind of like that way, and now go this way, and now look. Do you have any of those? Not nearly as dark, not nearly as deep. And then if you look straight, let me show you when you're looking straight. Hold right here, like there. Look up here. The height of everything, and then the chin. Insane. I love it. So let's give her the mirror. Grab that mirror. We'll give this back to you, Jordan. It's amazing, literally incredible.
I have an idea.
Hold on. Now, let's look in the mirror regular. Just kind of hold it up like this. Look up with your neck a little bit so you can see the angles. What do you think? Bring the light, shine it over here a little bit.
If we use some refit or high spot, it'll probably pop even more.
Where?
High spot, back row.
No, where do you want it though?
On her face. We put
Just
some,
overall? Yeah.
Yeah.
He wants me to put a little moisturizer on you so that you can
Or Emer
see
skin.
more of the contours. This is my skincare products, which are all peptides and brighteners. So he wants to do it because he thinks it'll brighten, which it will. That'll show
Camera
you
looks
more of the
good.
contours, which you'll be able to tell. Look. And this will not hurt you at all. This actually makes your skin look better. See?
That looks.
So now, if you guys see, looks great. Wow. Okay, look up just a little like this so he can show the pan. Grab the mirror from her, he'll show the pan, and that's it. Female facial sculpting. Just look straight ahead. Look straight ahead with the chin up a little.
Beautiful.
Wow. Okay, let me do the toxes. Which one is which? This one, 8. Okay, last part is we're gonna stop this chin movement.
Okay, there we go. Done.
Now.